It's a hot buzzword these days, GLP. So we want to explore it just a little bit more and get an expert in to explain it all.
Nima Marzoon is the CEO of UBI Telehealth and has the answers on all of it. No pressure on you, sir. How are you doing this morning?
Great. Thank you for having me.
It's a pleasure having you on. So how do the GLP-1 medications work and what are the actual benefits?
Right. Well, the GLP-1s actually have been in the market for a very long time. They actually came out in the 1980s, if you believe it or not. So we have a ton of experience with GLP-1s, but they've been popularized more recently. And people have noticed that they've had significant weight loss. They feel great. They feel better. They're healthier. Their risk of cardiovascular death has gone down, and so on and so forth. So how can you get your hands on a GLP-1? The best and the first thing to do to see if you're a candidate for it, talk to your physician. There are many, many vendors out there that are selling this, and you really need to go through your physician to really understand, the best type of medication that works for you. Having said that, the GLP-1s for the most part work on the receptors called the GLP-1 receptors in the gut, as well as the central nervous system. And most people don't know the second part. So what happens is they basically first, they lazy the gut, they lazy the stomach, and they reduce the emptying of the stomach, of the contents of the stomach. So people start to feel that their appetite gets suppressed. But on top of that, they also work on the central nervous system to reduce that food craving. So a lot of us have this, it's not real hunger, but it's food noise. And it's emotional hunger. Mm-hmm. And the GLP-1s actually do work on the receptors in the brain, the dopamine receptors that are the reward system, if you will, and actually do reduce the food hunger. And actually, most recently, we've been seeing that it actually also reduces the hunger for alcohol, the alcohol noise. So people are eating less, they're drinking less, and they're getting healthier.
Wow. Wow. I mean, you mentioned a lot of these positive results, but also with this type of medication, there's a common side effect that involves nausea. How do people sort of react to that? And what are some ways to help if they're on this medication and they experience that?
Yeah. Nausea and constipation are more common with the GLP-1 medications. The majority of patients, if they follow the directions of healthy habits, it tends to be very minimal. It really happens in patients, in our experience, and we've seen many, many patients with this. It really happens in patients who really think that the GLP-1s are a magic drug. They're just going to take the GLP-1 and they don't have to do anything else. They don't have to modify their diet. They don't have to exercise. And so those are the patients that tend to have the side effects. If you really follow a good dietary habit, you reduce your fatty intake, you reduce your sugar intake, you have multiple small frequent meals, and then you do the right things, it tends to be very minimal.
Right, okay. Another side effect that I've experienced is I can turn on the TV, commercials everywhere, I go on my phone, commercials everywhere. There are so many different outlets to get this GLP medication. How do you know who to trust? How do you know who's reputable, who's actually giving the real medication out?
That's a really good question. So the consumers are inundated with this, and you're bombarded with all these vendors that are giving this. So who do you trust, and what do you do? The key answer there is you really need to go to a vendor that is physician run. You want to be able to talk to the physician. You want to be able to talk to the physician on video if you can. You want to be able to know the license number of the physician. The other way that you can make sure that it's safe is you want to make sure that they're certified by Legit Script. So if you go to our website, ubitll.com, you go all the way down to the bottom, you will see that certification. And that certification renews every single day.
So do your due diligence.
Do your due diligence.
Yeah.
Well, for our viewers watching, you actually have a special offer.
Yes, of course. Yes, if you use the code WELCOME20, we will be able to sign you up. And that special offer does include a constant touch point by a physician. So there's actually a physician that's licensed in your state. We have about 200 physicians, and we hand selected the ones for Nevada and the surrounding area. And so you can actually have a touch point on video if you like, or audio if you like, on us every single week with actual physician.
Well, we appreciate you coming in and dispelling some of those myths and giving us some information. So, guys, UBI Telehealth is currently offering $20 off your first order when using the code WELCOME20 at checkout.
To take advantage of that offer and to learn more about their array of services, just visit ubitelehealth.com.